Hello, so I got tagged on this post in one of the dental forums, and this is a doctor asking a question: what are some of the options to help this patient who's 13 years old? He's got this tooth, which is number 14, that's decayed. Obviously there's a large decay here. We can see with the gray area that extends into the nerve. You could pulp test this tooth, but there's a good chance that this tooth is either developing irreversible pulpitis, or he already has. So most likely you would need a root canal, and then you would need a crown and a buildup. Now, it's hard to tell how deep the decay goes, but these are probably the borders of the decay, and it's pretty close to the alveolar bone, which is this level right here. And a lot of times when the decay kind of extends into the bone level, oftentimes you develop a deep pocket when these teeth are restored, and then you have kind of like a periodontal issue here as well. And then we used to do a little bit of crown lengthening for that. And once you do all this work, obviously, I mean, this tooth becomes pretty broken down. Now, there are some other options too. So you could do the traditional method, which would be probably root canal, a build up, and a crown. If you're encroaching on the biological width for the alveolar bone, where your crown margin ends and where the bone support is, then you may even have to do some crown lengthening, where you take away a little bit of bone in this area to prevent periodontal issue and inflammation. Now, that would make this tooth pretty compromised. So there's also, I like to propose another alternative, what you could do. Assuming, I mean, this patient is 13, so he still has his wisdom tooth most likely. So one of the other things you could do is actually you could do orthodontics. So when this tooth is this broken down, to prevent doing all that work for guarded prognosis, one of the things that you could do is you could extract this tooth, and this is number 15, and number 16 is probably up here. You could very easily move this number 15 into the position of 14, and 16 would come with it and become number 15. So then you would have two healthy teeth to substitute for this really broken down tooth, and then you would not have to do the root canal, the build up, the crown lengthening, and the crown for this tooth. But essentially what you would do is move this number 14 in a position of number 15 in a position of 14, and number 16 in a position of number 15. And that's very, very easy to do with orthodontics. Matter of fact, these teeth oftentimes want to mesialize, and once you extract this tooth, they'll actually start drifting mesially. So that's fairly easy to do, and it doesn't take very long at all. The treatment time would be probably somewhere around 9 months. To mesialize this 15 into the position of 14. So hopefully that helps. If you have any questions, always welcome to tag me. Check out our orthodontic mini residency, where we talk about topics like this. So have a good rest of the day.